Welcome to this lecture on coronary angiography. My name is John Boland, and here we'll be looking at the coronary arteries in a little more detail, the various angiographic views we have to identify the LAD and the circumflex and the right coronary artery. This is a slide showing again a diagram of the heart with the vessels prominently shown for the right coronary artery on the left and the left coronary artery on the right. The pictures are a little small to be of much use, but if you look at the top left, you can see this is the LAO view for the right coronary artery, and this is what is referred to as the C shape. Again, I'm a little bit skeptical, but it's a guide. LAO gives you that C shape. And the other view is the right coronary artery in the RAO position, the profile of the heart. And you can see how this does almost a right angle bend and vessels go inwards, so that this region of the heart has overlapping vessels. Whereas the left system in the LAO, the LAD stands out here just off the vertical and the circumflex goes off to the right. Whereas in the RAO, the circumflex has been more separated from the LAD and the LAD has been forced to the right. The heart itself has sort of rotated in the RAO. We'll try to relate these anatomical details to identification of these coronary arteries with our angiography. More diagrams. Note on the right, you have your ascending aorta and your aortic root with your three sinuses of Valsalva, with the left coronary cusp giving rise to the left coronary artery and the right coronary artery coming off the right coronary cusp. And there's the third non-coronary cusp there. Now we went through the supply of blood to different chambers or different parts of the heart in our ECG lectures, but I think I drummed into you that the right coronary supplies the inferior wall of the left ventricle. Remember, leads 2, 3 and AVF, look at the right coronary artery. And the right coronary artery supplies the inferior wall, the right atrium as you'd expect, and also the SA node and the AV node. You can learn the rest at your leisure, but the LAD supplies a big section of the anterior segment of the heart, the anterior right ventricle, and the apical and mid-septum, including the bundle of His, so that you would remember the condition of left fascicular block is synonymous with left axis deviation, and you get that because of a conduction defect resulting from, most likely, a compromise of blood supply to that bundle of His. The left circumflex, on the other hand, supplies the lateral wall. You can imagine that with the circumflex going down to the side, and also, as you know, in some people, the SA node. I'll leave you to memorize all that. Knowing all that helps you understand how we view the coronary arteries from all our different angles. This slide is in the RAO position. The heart is in profile, and you have your major vessels there. You can see the right coronary artery feeds the inferior surface of the heart with penetrating vessels going into the heart. Whereas the LAD goes forward right to the apex of the heart and the circumflex wraps around the left lateral surface with marginal branches coming off there, septals to the left and diagonals to the right in the LAD. This shows rather nicely how those branches arise from the left coronary artery and the right coronary artery. You can see the main trunk branching into the left circumflex with the marginal branches from the circumflex. We identify them as 1, 2, 3 and 4, first, second and third marginals. Same with the LAD and the septal perforators, first, second and third. And the diagonals, which branch to the right, we call first, second and third diagonals. Note that some people have an extra vessel in there called the intermediate. The right coronary artery, as I said, is quite simple. It courses down the inferior wall of the heart, as we've already seen. There are some very nice drawings out there. This is a little card, a pocket card put out by Cordis. It shows you the RAO and the LAO. And the LAO in the right coronary artery is that C shape. And this shows nicely the little branches that come out. You'll never find drawings that are exactly the same as any other. If you look at enough of them, you'll pick up your fine anatomy and your coronary circulation. They've got some helpful hints in terms of identifying the orientation. In the LAO, the spine is on the right. In the RAO, the spine is on the left. Beware, because this doesn't always apply. But if you're looking at an angiogram and you have no idea, that's a starting point. The circumflex lies closest to the spine. Again, it doesn't apply in every situation, every angle, but it's useful to know. And in the LAO, as you've seen, the apex rotates slightly to the left, and in the RAO, the apex points to the right in the bottom left-hand quadrant. In the LAO, the LAD lies to the left. The LAD reaches the apex, and in the LAO, the right coronary artery resembles a C. Again, you've seen that's not that convincing, and even here in the LAO, the LAD can be almost vertical, depending on the actual degree of orientation. But use whatever works for you. Eventually, you'll know it and not need these little helpful hints. Going on to the left coronary artery, you've got all these different views again. The RAO, the profile of the heart. The AP, we don't often take AP shots of the LAD. And the spider view, the caudal, LAO caudal. The reason it looks like this is that, as in the right coronary artery, the LAO caudal wasn't shown in the previous slide, but the LAO caudal views the heart from below, from underneath. So this is how the heart would look if you looked at the coronary arteries from the inferior view. Remember also that the caudal angulations are better for the circ, and the cranial angulations are better for the LAD. All these useful tips will help you identify these vessels, but it's never as clear as this on the angiograms. Well, not always. So remember also, the terminology for RAO and LAO and caudal cranial views has been reversed by radiologists and cardiologists. We view the heart in terms of the reference point from above the patient, from the detector. Radiologists view the reference from the source, and that goes for all the angles. Just remember that. Don't get confused if you read a radiography journal. More angles showing you nicely how the angulation through the different parts of the heart gives you these orientations. And the LAD with the septal perforators, diagonals, and the rotation of the heart and the LAD, and here the spider view. You should really understand the spider view by now. I would think the RAO and probably the LAO and the LAO cranial for the LAD. And for the circumflex, that view of the heart in profile shows the circumflex nicely. This slide shows more views. I won't go through it. We won't extend this lecture more than we have to. But again, it shows you diagrammatically how the vessels lie in relation to each other with different angulation points. This is a useful slide to keep in your mind. It shows how there are two planes of reference for coronary angiography, for cardiac angiography, two intersecting planes at right angles. And you can see here how the right coronary artery and the circumflex lie on that flat plane in that direction, and the LAD and the right coronary artery, the PDA, lie in that plane. That's viewing the heart in the RAO, in that profile view of the football that I like. And this is the LAO, showing again that plane for the right coronary artery and the circumflex, and the same plane for the LAD and the PDA. So that is pretty convincing, and it should help you understand how the anatomy and the identification of the coronary arteries work. You can use a three-finger rule for the left coronary artery. This is a shot of a fist, the right fist, showing the coronary arteries, illustrated by the index finger and the ring finger. And I just rotated my camera around this hand to get different views. You can see how this one would be the LAO view of the LAD, and that might be a cranial rotation. See how this part of the LAD is rotated, whereas this is flat. So is the circumflex. This would be a good view for the circumflex. It's useful to play with your fingers. If you look at it yourself, you'd have to use your left hand. But in fact, if somebody else shows you, you'd have to look at your right hand. And here, I'll plug the handout that I gave you as reading material by Morton Kern. It's the best explanation I've come across for describing the orientation of coronary arteries. Angiographic projections made simple. So I hope you take the time to read that. It'll consolidate very nicely almost everything I've told you. Again, the three-finger rule, RAO view, LAO cranial. Remember, the LAO cranial tips the heart forward, whereas the RAO caudal tips the circumflex forward and separates the circumflex from the LAD. And this is that nice profile, showing nicely again how that plane between the circumflex and the right coronary lies together. And if the thumb was longer, the LAD and the PDA would line up together as well. To identify vessels, it helps to recognize the angles. But you can do it the other way around because you can identify the vessels more easily. You know that's not going to be the circumflex. But here, as I showed you before, the straight cranial view, when the image shifts to the right, when the detector shifts to the RAO, the structure also shifts to the RAO. And that shows it very nicely here. And caudal angulation, especially RAO caudal, separates the circumflex very nicely and is a good view for the circumflex. Remember, cranial angulation is good for LAD and diagonals. Caudal angulations good for the circumflex. Again, more views. Spider view, you should recognize that one by now, and I guess you could start remembering 40-30. Spider view 40-30, we've learnt that now. And the LAO for the LAD, LAO cranial, the heart is tilted forward. LAO cranial, the heart tilts forward, so you can remember that one. LAO 44, cranial 20, and that's the LAD coming towards you. We'll skip this one. I included it only to show you that you don't always get good images from the angiograms, and you just wear it. You either repeat the view or you just move on to a better view. And the RAO, again, that profile of the heart, and the RAO caudal, again showing the circumflex. I've shown you these in different forms already, but again, LAO caudal, the spider view. You get straight caudal view, we haven't seen too much of that one. The RAO caudal, good for the circumflex. You can see how it's nicely separated from the LAD. Cranial views for the LAD. Cranial views are good for the LAD and the diagonals. Caudal views are good for the circumflex. And again, RAO cranial for the LAD. It shows you a good view of the proximal segments. And the LAO cranial here, just a slightly different angulation that tilts the heart a little bit more forward and separates the circumflex a little more out. I think this is a better view. Everybody has slightly different anatomy, so the same views don't always apply. I'll just go back to the previous slide. Now, I hope that looking at these helps you understand how angulations work in the cardiac catheter lab for both cardiac structures and for coronary angiography. When you do your cath lab term, you will be more appreciative of how we identify these structures and these vessels. Remember to read that paper by Morton Kern and the other references I give you. They're all very useful. And with that, I'll end this lecture.